Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Good evening, everyone. Today, focus on one small molecule with a much larger story than most people expect. Vitamin C as a supportive strategy for difficulty sleeping. Now, listen carefully. Do not think of vitamin C as a sleeping pill. Do not place it beside sedatives, antihistamines, or prescription hypnotics. Place it somewhere more precise, in the biology underneath sleep. Ask yourself, why does the body fail to settle at night? How does a tired brain stay alert against its own will? Why can someone feel exhausted but still unable to sleep? Insomnia is not only a nighttime event, it is often the final signal of a daytime system that has not returned to balance. Stress hormones may be elevated, inflammation may be active. Oxidative stress may be higher than the body can comfortably neutralize. Iron handling may be poor, restless legs may appear, mood may become tense. The nervous system may remain on guard. So here is the key idea. Use vitamin C not as a knockout agent, but as a biochemical support tool. Use it to help the body repair, regulate, absorb, protect, and calm the internal conditions that may be keeping sleep unstable. And ask, why vitamin C? How could something associated with oranges, immunity, and colds have anything to do with insomnia? Because vitamin C is not merely a cold vitamin. It is involved in antioxidant defense, neurotransmitter biology, collagen formation, immune regulation, and the absorption of non-heme iron from plant foods. The National Institutes of Health also notes that the body tightly controls vitamin C levels and absorbs moderate doses better than very large doses. So begin with this instruction. Look beneath the symptom. If sleep is the visible flame, ask what is feeding the fire. First, examine oxidative stress. What happens during poor sleep? The body does not simply lose hours, it loses restoration. Sleep deprivation can increase oxidative pressure, disturb inflammatory signaling, and alter stress biology. Why does that matter? Because the brain is metabolically intense. It consumes a great deal of oxygen, handles delicate neurotransmitter systems, and depends on well-regulated antioxidant defenses. Vitamin C is one of the body's water-soluble antioxidants. It can donate electrons, neutralize reactive oxygen species, and help regenerate other antioxidants such as vitamin E. That means it participates in a quiet defense network that works every day, whether we notice it or not. Now ask, how can that help sleep? If oxidative stress is one of the background signals making the nervous system feel irritated, inflamed, or overactivated, then improving antioxidant status may help reduce that load. It may not force sleep, but it may make sleep more biologically possible. A review in Nutrients examined vitamin C in relation to physical activity and sleep, and discussed its possible relevance to sleep duration, sleep quality, insomnia, obstructive sleep apnea, and restless leg syndrome, especially through the shared pathway of oxidative stress. So do this. Stop thinking only about the bedroom. Think about the bloodstream. Think about the nervous system. Think about redox balance. A person may dim the lights and still carry a body that is chemically bright. Second, examine stress hormones. Why do many people wake at 2 or 3 a.m. with a racing mind? Why does the body feel as if it is preparing for a meeting, a threat, or a battle when the room is silent? One reason is the stress response system, especially the hypothalamic pituitary adrenal axis. Cortisol is supposed to follow a daily rhythm, higher in the morning, lower at night. When stress biology becomes poorly timed, sleep can become shallow, delayed, fragmented, or cut short. Here is where vitamin C becomes especially interesting. The adrenal glands contain very high concentrations of vitamin C, and research describes vitamin C release in response to ACTH, a hormone that stimulates adrenal activity. A review on the adrenal vitamin C axis explains that humans, Other primates and guinea pigs cannot make vitamin C internally, while many animals can produce it, especially during stress. The same review describes evidence linking vitamin C status with cortisol response. Ask yourself, why would the adrenal gland hold so much vitamin C? How could stress biology depend on a nutrient humans must obtain from food? That question changes the conversation. It suggests that when the body is under psychological pressure, illness pressure, smoking pressure, inflammation pressure, or heavy exercise pressure, vitamin C demand may matter more than we assume. Now use this practically. If insomnia appears during a season of stress, do not only ask, what can sedate me? Ask, what is my stress system consuming? Support the system earlier in the day. Give the body the raw material it already uses. Third, look at population evidence. A cross-sectional analysis from NHANES 2017-2018 examined 3,227 adults and found that higher serum vitamin C was significantly associated with lower odds of reporting trouble sleeping after adjustment for potential confounders. The reported odds ratio was 0.816 with a 95% confidence interval of 0.669 to 0.995. The association was also seen in women, adults 65 or younger, and participants with high cholesterol, and the study found a non-linear relationship between serum vitamin C and trouble sleeping. Now be disciplined. Do not overstate this. This does not prove that vitamin C cures insomnia. It shows an association. But ask, why would people with better serum vitamin C report less trouble sleeping? How much of sleep quality is actually a marker of total metabolic resilience? A separate analysis of circulating antioxidants in NHANES 2017-2018 also reported that vitamin C, along with several carotenoids, was associated with lower risk of overall trouble sleeping symptoms. So say it plainly. The evidence does not give us a magic button, but it does point toward a pattern. Better antioxidant status appears to travel with better sleep reports. That is not something to ignore. Fourth, connect vitamin C with iron and restless legs. Have you ever seen someone who is tired, lies down, and then feels the legs begin to crawl, pull, twitch, ache, or demand movement? Why does that matter? Because restless leg syndrome can sabotage sleep onset and sleep maintenance. It can look like insomnia, but the engine is different. Iron status is central in many cases of restless leg syndrome, and vitamin C improves the absorption of non-heme iron, the type found in plant foods. How should you use that information? Do not self-prescribe high-dose iron. Check ferritin and iron studies with a clinician if restless legs are present, but if dietary iron is appropriate, pair plant-based iron sources with vitamin C containing foods. Add bell pepper to beans. Add citrus to lentils. Add kiwi or strawberries near an iron-containing meal. Do it deliberately. A randomized, double-blind, placebo-controlled trial in hemodialysis patients with restless legs syndrome studied vitamin C and E and reported benefit in that specific population. Again, stay precise. That does not mean every person with insomnia needs vitamin C and iron. It means this. If the insomnia is actually driven by restless legs, investigate the nutrient pathway. Ask why the legs are restless. Ask how iron is being absorbed. Ask whether vitamin C is part of the missing support. Fifth, consider mood and neurotransmitter biology. Insomnia often comes with anxiety, low mood, irritability, or mental overactivity. Why? Because sleep and mood share overlapping chemistry. Vitamin C is involved in the biosynthesis of certain neurotransmitters, and inadequate intake can present with fatigue and low vitality. So ask, how does a nutrient influence the mind? Not by acting like a tranquilizer, but by participating in the maintenance of systems that regulate energy, stress response, and neurochemical function. If someone has low vitamin C intake, poor diet quality, smoking exposure, heavy stress, or chronic inflammation, their nervous system may be operating with less biochemical support than it needs. use this command. Build the foundation before blaming the pillow. Many people change mattresses, apps, pillows, and alarms, but never examine whether the body has enough basic nutritional support to perform repair at night. Sixth, apply it correctly. Do not start with megadoses, start with consistency. The adult recommended dietary allowance is 90 milligrams per day for men and 75 milligrams per day for women, with higher needs for smokers. The adult tolerable upper intake level is 2,000 milligrams per day. The NIH notes that about 70% to 90% of vitamin C is absorbed at moderate intakes of 30 to 180 milligrams per day, while absorption drops below 50% at doses above 1 gram per day. So what should you do? Choose food first. Use citrus, kiwi, strawberries, guava, bell peppers, broccoli, Brussels sprouts, potatoes, and leafy greens. Put them into the day, not randomly, but strategically. Use timing wisely. If vitamin C feels energizing to you, take it in the morning or early afternoon. Do not force it at bedtime. If you are using it to support iron absorption, take it with the iron-containing meal, not necessarily at night. Use moderate supplementation if needed. Many people do well with 100 to 250 milligrams per day from food plus supplement combined, or a modest supplement when diet is inconsistent. Some may use 500 milligrams, but bigger is not automatically better. Remember, the body controls vitamin C tightly. Protect safety. If you have kidney stone history, kidney disease, iron overload such as hemochromatosis, or you are receiving chemotherapy or radiation therapy, speak with a clinician before using vitamin C supplements. High intakes may cause gastrointestinal symptoms and can interact with some medical treatments. Now ask, how will you know if it is helping? Track sleep for 2 to 4 weeks. Do not judge by one night. Watch sleep onset, nighttime waking, morning energy, leg restlessness, stress reactivity, and daytime fatigue. If nothing changes, do not keep escalating the dose. Reassess the cause. Is it caffeine? Alcohol? Sleep apnea? Depression? Pain? Medication? Menopause? Shift work? Screen exposure? Anxiety? Chronic insomnia often needs a broader plan. And keep this clinical anchor. Cognitive behavioral therapy for insomnia is recommended as first-line treatment for chronic insomnia in adults by the American College of Physicians. CBTI includes stimulus control, sleep restriction, cognitive work, and sleep education. So do not replace evidence-based insomnia care with a supplement. Combine wisely. Use vitamin C as supportive physiology, not as a substitute for diagnosis. Seventh, place vitamin C inside a sleep protocol. Here is a practical sequence. Follow it. In the morning, get outdoor light. Why? Because circadian rhythm needs a clear daytime signal. At breakfast or lunch, include vitamin C-rich food. How? Add berries, kiwi, citrus, peppers, or greens. If you eat plant-based iron, pair it with vitamin C. Why? Because absorption improves. Limit caffeine after late morning or early afternoon. Why? Because even when you feel fine, adenosine signaling may still be blocked. Move your body, but avoid intense exercise too close to bedtime if it activates you. How? Place exercise earlier. In the evening, lower light, lower emotional intensity, and lower temperature. Why? Because sleep arrives when the brain believes the environment is safe. If you supplement vitamin C, keep it moderate and earlier in the day unless you clearly tolerate it at night. How? Test timing, observe, adjust. And if insomnia lasts 3 nights per week for 3 months or longer, or if you snore heavily, gasp, have severe daytime sleepiness, restless legs, depression, panic, or persistent pain, get evaluated. Do not normalize suffering. So, why can vitamin C be beneficial for insomnia? Because sleep is not only a behavior, it is a biological state built from antioxidant balance, stress regulation, immune quieting, neurotransmitter support, and nutrient sufficiency. How can vitamin C help? It may reduce oxidative burden, support adrenals, stress biology, assist neurotransmitter-related processes, improve non-heme ion absorption, and strengthen the background conditions that allow the nervous system to shift from alertness into restoration. But remember this clearly, vitamin C is not a sedative, it is not a cure-all, it is a support. Use it with intelligence, use it with food, use it consistently, use it safely. Use it as one piece of a complete sleep strategy. Tonight, ask yourself one final question. Is my body failing to sleep, or is it asking for better support before sleep can happen? Start there. Build the foundation. Respect the biology. And let sleep become not something you chase, but something your body is prepared to receive. Thank you, everyone. Take care of yourselves and each other like family, and I'll see you in the next topic.